For today's numbers, there are currently 73 people hospitalized with COVID-19, with 12 of those admitted to ICUs. In total, there are now 4,659 people who have recovered from the virus, leaving just 1,524 active cases in Alberta. In the last 24 hours, out of 2,864 new test results, there were 47 new cases. I'm sad to report 2 additional deaths, which occurred in continuing care facilities in North and Calgary zones. 2 previous deaths that were reported have since been ruled as unrelated to COVID-19. Therefore, the total number of COVID-related deaths in Alberta remains at 117. We are forced to grieve differently in this time of pandemic, physically distant from extended family and friends, and I offer my sympathy to all those navigating that difficult terrain right now. As of today, there are 102 active cases in outbreaks at continuing care facilities across the province. 542 residents of continuing care facilities have recovered. At the Cargill facility, there are now 36 active cases in workers and 911 workers who have recovered. Unfortunately, 1 death reported over the weekend was an employee from Cargill who fell ill last month. Although we are speaking about this today, the individual was hospitalized about a month ago. I offer my sympathy to the friends and family of this individual and all those who have lost their lives from COVID. There are also 58 active cases among workers at the JBS plant in Brooks. At this facility, 548 have now recovered. And at Harmony Beef, there are 16 active cases in workers and 22 individuals have recovered. 1 additional case has been identified at the Calgary Remand Centre, again through the facility's rigorous screening process when individuals are admitted. This case is not related to the case I reported last week, meaning there is still no evidence of transmission within the facility. I would also like to mention that we have 3 confirmed cases in workers at 2 unrelated Calgary daycares. The cases in question are isolated, and the daycares are currently closed as a precaution. All those who work in or attend the daycares are being offered testing, but at this time there is no evidence that the transmission happened in these settings. Public health officials continue to respond to each outbreak, contain the spread, and ensure all public health measures are enforced and being taken seriously. I also want to provide an update on the cases at a Canada Post location in Calgary that I was asked about last week. There are 6 cases that have been identified at workers in this facility. However, there were no connections between them, and their exposure seems to have been outside the workplace. A deep cleaning of the facility has occurred, and there is no evidence of transmission at the workplace, meaning there is no need to do testing of staff who do not have symptoms. It may seem odd to contemplate restarting the economy after hearing about these outbreaks. While the final decision on entering Stage 1 has not yet been made, today I want to talk about why we can consider relaunch at this time. First, the outbreaks I mentioned represent pockets of infection that we must deal with. However, much of the province has been successful at flattening the curve. Hospitalizations and ICU admissions are down, recovered case numbers are up, and I am encouraged to see fewer daily new cases than even 1 week ago. We continue to see cases of community transmission, and people have asked me how we can reopen our province when the virus is still spreading in our communities. We put our first restrictions in place after identifying 1 case of community transmission. That was in early March. I know it feels like a long time ago, and that is exactly the point. Much has changed in our society since then, and it will remain different for a long time still. This week, we will be offering extra testing in Calgary, as we are still seeing higher case numbers there than the rest of the province. While we don't know how much asymptomatic spread may contribute to transmission in a population, we know it is possible. Therefore, to get a broader snapshot of infections in Calgary, we will be making testing available for 1 week, starting today, to asymptomatic Calgary Zone residents who work outside the home. We can only test up to 1,000 people per day in order to make sure we leave room to test those who are sick. But I encourage anyone in the Calgary zone who is interested to participate to go online and register for a test. Booking will be first come, first serve, up to a maximum of 1,000 asymptomatic people per day. It is important to remember that testing people who aren't sick just gives a point-in-time picture of whether they have the virus at a particular moment in time. It is possible, if someone has had an exposure, that they could test negative but go on to get sick later. However, offering testing to this group of people will give us more information about COVID-19 in Calgary at this point in time.
As Premier Kenny has announced, we are relaunching our economy in stages, beginning with stage 1 later this week. Alberta's staged relaunch strategy puts safety first as we gradually reopen the province and get people back to work. This is a result of the hard work of Albertans and their adherence to public health guidelines. The safety of Albertans will inform all stages of our relaunch strategy. This strategy was developed with advice from public health officials as we carefully and gradually lift the restrictions on our economy and our lives.
The important thing for businesses to consider is what mechanisms can they put in place to make sure that patrons understand what is required of them. And so different businesses, it's going to look different in each context. So you'd ask specifically about retail. And I think the things that a retail environment can do to lessen the chance that someone who's sick would be in that store, things like posting signs to make sure that people remember if they're feeling ill, they should go home. They should not be in that retail environment. And if someone is actively ill, then it could be the retail store employee or the manager. If somebody is, coughing and sneezing on the goods, then that person may say, I'm sorry, you need to leave the store, you should go home. A reminder of that. I think this is an encouragement for all of us to remember to reinforce the social norms with each other, that if we're sick, we should not go out. It is not expected that in a retail store there be someone with a thermometer checking temperatures at the door. That is not the expectation. But the expectation is that retail stores would reinforce the social norms in whatever manner is appropriate within that setting. And again, that could include signage, it could include reinforcing when they do see someone who's there who's visibly ill, and of course making sure that they have a mechanism for checking their employees every day. So as their employees are coming to work, making sure their employees are feeling well and not sick, and if they are sick, then having them go home and make sure that they're tested if that's appropriate.